All right, my friends, today is day 41 of 42. Can you believe it? Can you believe it? Can you believe it? If Hercules were here, he'd be going, Hercules, 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 but he's at work. Anyway, day 41 of day 42. You guys have come this far. You know for a fact there's no turning back now for any of us, okay? Day 41, day 41, day 41, day 41, extremely exciting, extremely exciting. No words can explain it, okay? But I want to just say to you, pat yourselves on the back, give yourselves a round of applause, shake each other's hands, because you guys have come a long, long, long way. And when we first started this game together, 42 days sounded like a lot, but here we are. We made it. It's like our plane is about to land. It's like we've begun our initial descent into ultimate pulmonary wellness land. And for that, I say, you guys are killing it. I am proud of you. I am amazed by you. I am shocked I'm a little shocked. I have to be honest. I'm a little shocked. I wasn't sure when we first started what would happen. I really wasn't sure, but now I know. It works, thanks to you guys. All right, my friends, day 41, the penultimate day, one day before graduation. Let's do it. Have a great one. Alrighty, so today's question of the day, Dr. Noah, I want to thank you first for what you're doing for people that have COPD. You're welcome. I'm going to skip all the effusive praise. As much as I want to read it. All right, so here's a question. I have a compression fracture in my spine and was wondering about exercise. I know how important it is to keep moving, and I value your opinion. Any suggestions would be greatly appreciated. I know what can happen with lack of exercise, and I am concerned. Any help or suggestions would be greatly appreciated. I am going for an MRI to see if there's anything that can be done. All right. So here's the deal. When you have and I'm gonna talk specifically about this question, but I'm also gonna generalize and talk about general orthopedic and musculoskeletal issues. So a compression fraction, essentially what we're saying is that there has been for lack of a better word, and the reason why that's the best name for it, compression of the vertebrae, okay? And for those of you that don't know, or for those of you that do know, okay, our vertebrae are these kind of vertebral bones that sit on top of each other, separated by a disc that is like a shock absorber, and running through the bones is basically what we call foramen, where the spinal cord runs through. And so the nerve roots then come off at each level, okay, and supply innervation to different body parts and different muscles, et cetera, et cetera, et cetera. As an example, from the cervical vertebrae, which is your neck, cervical vertebrae 3, 4, and 5, or the nerve roots coming off of 3, 4, and 5, innervate the phrenic nerve, which then innervates the diaphragm. Okay, so that's one example. Generally, the cervical vertebrae will take care of the upper body and the upper arms. The lumbar will take care of the lower body and the legs. And a good way to think about spinal injury or spinal damage or anything like that, or spinal overuse, whatever you want to say, is that the higher up the injury and the higher up the damage, the worse it is, because much like a tree and its roots, okay, the higher up, everything above affects everything below. So you can have an injury down low. For example, a paraplegic could get shot in the lumbar spine, which is the low back, and wind up unable to walk, but still have full body strength in the upper body, okay? Now, in this specific instance, Brenda, you don't say where your compression fracture is, okay? More often than not, it will be, I won't say more often than not, but, if it's the cervical vertebrae and it's a cervical compression fracture, well, that's gonna, we're talking about your neck, and that's gonna affect your upper body and could potentially affect your breathing. If we're talking about thoracic, we're thinking about the muscles around the rib cage. And we're also talking about the lower body. And if we're talking about lumbar, we're talking about lower body. When it comes to any type of fracture, whether it be a compression fracture, and a compression fracture simply describes the type of fracture of the spine, meaning that the spine becomes compressed and there's a break in the spine. That's what fracture means, okay? A lot of times people say broken or fracture. Fracture and break is the same thing, okay? So there's a fracture, there's a break in the spine, and the thing about it is that oftentimes, particularly in the spine, particularly in the ribs, people can have spontaneous fractures or pathologic fractures where they don't necessarily have to have a trauma of any sort, but because of age, because of osteoporosis, because of, and these things can occur also as a result of long-term oral or IV steroid use, some of the other medications, some of the proton pump inhibitors that are used for reflux can cause osteoporosis. But what basically happens is that the bones eventually become thinner and thinner and thinner, and then sort of without doing much, maybe you turn the wrong way in bed, or you cough too hard, or this or that and the other thing, and you wind up with a fracture. When it comes to a fracture, the questions that we need to ask are, was it displaced? So in other words, you can have a fracture in the spine and absolutely no movement occurs. So there's a little crack, but stays in place, okay? Doesn't affect anything structurally like the spinal cord or the nerve roots or the disc or anything like that. And obviously that's going to be less serious than when there is displacement or movement, okay? And further instability. So the questions really become, well, is it stable or unstable, like many of the other things we talk about? What is the potential for future damage? And what is the treatment, and what are the restrictions? Okay, so in a case like this, I would certainly need to know more information. I would want to know, where is the fracture? What part of your spine? Cervical, thoracic, lumbar, sacral, coccyx. And then when it occurred. Okay, sometimes people don't even know that they have a fracture. So as an example, somebody may go for an x-ray for something else and they say, hey, did you know you had a fracture? And you say, no, I didn't know I had a fracture in my spine. So the question is, when did it happen? How stable is it? And what, if anything, is going to be done? And those are things that are going to play a big role in how much exercise you can or can't do. So if it's stable, well, first of all, let's talk about grading and time, okay? So it generally takes about 6 to 8 weeks for bone to heal completely to where it's stable again. Again, there are factors that are going to make it more difficult for you to heal, things like osteoporosis. And then, we assume 6 weeks or so for a straightforward heal for somebody who's got good healing ability and good ability to regenerate bone tissue, which is called osteogenesis, okay? So the other aspect is that if you do have osteoporosis, if you do have other things that prevent you from laying down bone, then that could definitely prolong the healing time. And in some cases, it may be determined that the fracture is not going to heal on its own, or the fracture is not going to wind up in a stable position on its own, and that's where surgical procedures come in. I assume that you would have mentioned surgery if you had surgery, or if you're going to have surgery, but that may not be known, okay? You're going for an MRI to see what's what. The MRI is going to tell you everything. So it's going to tell you, where is the fracture, how bad is the fracture, approximate age of the fracture, et cetera, et cetera. So other things to consider. Are you in pain? Okay. Sometimes people will have a fracture and they don't necessarily wind up with a lot of pain. That could be a blessing and a curse, because pain is something that tells us when we need to slow it down a little bit, or when we need to go easy a little bit. And so for the person who has zero pain, Well, that gets tricky because you can still have an unstable fracture even if you don't have any pain. So that's why I think nothing can be said until you get the results of the MRI. If it's 8 weeks old, 12 weeks old, a year old, then nothing's going to change at this moment unless it's pressing on the cord and in some way is going to impact your ability on a go forward basis, or if it's unstable and your doctor feels like it needs to be stabilized for your safety. So I think I'm not going to give you a suggestion until you have the MRI. But that being said, I agree. We want to get back to activity gently, okay, gradually, slowly, and only in a way that's not going to stress the fracture even more and prevent it from healing. Now, there are things that will help it to heal along. Exercise can actually help with bone growth, but we need to make sure that the fracture is already stable, okay? Now, let me address musculoskeletal injuries in general, okay? When somebody has not exercised for a long period of time, it is very, very important that they go very slowly at the beginning. This is why our program, both online as well as at the center, is designed with a no setback approach, so that it's not like all of a sudden we're going, go, 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 and then you come in the next week and you're like, oh, I think I went too far, or you did too much, or I overdid it, or this and that. As a physical therapist, we often get a lot of business from people. As physical therapists, we have to be very, very careful, particularly with people who have not exercised in a long time. And depending on who you are, a long time could be 2 weeks. It could be a month. It could be 6 months. It could be a year. Some people come to me and legitimately have not exercised in 30 or 40 years, okay? So that person is going to be much more prone to a musculoskeletal injury. And when we talk about musculoskeletal injuries, okay, it could be the muscle itself, but very often it's not. It could be the bone, okay? But we also have to look at the connective tissue, things like ligaments and tendons. And what ligaments do is they connect bone to bone, and what tendons do is they connect muscle to bone. And the thing that's really important to understand is that muscle tissue increases its tensile strength a lot faster than connective tissue does. So what happens a lot of times is somebody will start exercising and they start increasing the weight because they're getting stronger, and their muscles are getting bigger and their muscles are getting stronger, but their ligaments and tendons are not increasing in strength at a similar pace. So they're going a lot more slowly. So what winds up happening is the person goes up, 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 up the ladder, and then boom, right down the chute because they get some kind of injury, whether it be a tendon injury or a ligamentous injury or this, that, and the other thing. So my point in telling you all of this is that whenever you begin an exercise program, okay, it's always going to be better to err on the side of caution and to err on the side of underdoing it rather than overdoing it. And I'd much rather somebody walk out a block and come back a block and then do it again, rather than walk out 2 blocks and realize, hey, I can't get home. You know what I'm saying? So we want a no setback approach. We don't want any injuries. I have to know more about your spine in particular, but tell us what's going on, okay? Don't wait till the car goes off the road. Tell us when you start to hear a pinging noise when you drive, you know what I'm saying? And we want to know these things. So like we're monitoring your heart rate and rhythm, and you're monitoring, we're monitoring your blood pressure and your oxygen saturation. And yeah, most people come in limited by a pulmonary issue. So it's either shortness of breath or lower extremity fatigue from the inactivity. But the thing is that your musculoskeletal system may have never been challenged before because of your shortness of breath. Similar to what I talk about with the heart, very often we don't see cardiac symptoms because the person is first limited by shortness of breath and or lower extremity fatigue, and so they never get up to an activity level that will sustain, that will elicit these hemodynamic or cardiovascular or ischemic responses. And it could be something very similar with the musculoskeletal system. So, up until recently, you've been sitting in your recliner, you've been walking across the room, this and that, maybe you walk a block here and there, but you're not doing any type of exercise in a formal way, and particularly repetitive exercise, things like, walking about, or, any of these things where we're kind of doing the same thing, elliptical, treadmill, bicycle, et cetera, et cetera. Any of these things can cause an overuse injury or a repetitive strain injury. And, the idea behind these things is it's not like you get one knockout punch. No, it's that you get and you get this cumulative trauma, and that cumulative trauma eventually reaches the tipping point and you get an injury. Okay. This is the case for, getting a bone density scan. This is the case for having your spine x-rayed or MRI'd if necessary. This is the case for treating your bones and making sure that you're looking out for bone health, and ligament health and tendon health. Okay. So again, I hope that's helpful. Again, I know I'm not telling you everything because we need to find out what that MRI says. If the MRI says it's an old x-ray, then an old fracture, then we start building you back little by little. If it's something new, 2 weeks old, 4 weeks old, you're not really ready for any activity yet other than ADL, which is activity of daily living, and maybe some walking, okay? But we don't want to do anything that's either going to worsen an unstable fracture or take a fracture from stable to unstable, or anything that's going to slow down that healing process. So feel free to check in with me again once you have the MRI and find out some more information, okay? Hope that's helpful to you. Have a great day, everybody. Today is day 21. Am I crazy? Today is day 41. I was just seeing if you were paying attention. Day 41. Day 41. Tomorrow is the biggie. All right? It's been a pleasure, ladies and gentlemen. It's been a 41-day pleasure. Have a great day. Bye-bye.